Hi everyone, I'm Charlotte Kilpatrick reporting for Vaccine Nation from the World Vaccine Congress in Washington. I'm thrilled today we're joined by Latifat Okara from Economist Impact. Thank you for joining us today.
Thank you, Charlotte. This is nice.
It's lovely to have you here. So, could you start by just explaining a bit about your current role and what you're doing?
Fine, of course. So I sit in the Washington, D.C. office for the Economist Impact, and I am the principal for health policy research and insights. I lead up all our research work and insights work as well for health policy in the health practice.
Fantastic. So you joined us here at Washington, D.C. for the session on the importance of robust health and economic data. When we say robust, what do we mean by this and how can we achieve it?
Fine, that's a good question. Thanks. So my session on Monday was really talking about AMR, the antimicrobial resistance, and the role of having significant, robust economic and health data. And so, what this really means, in essence, is having thorough and fit for purpose data for use as we think about tackling antimicrobial resistance challenge across the globe. So, in 2023, Economist Impact actually released a report in partnership with Pfizer that looked at creating an economic model to help us ascertain what the health costs were as it relates to hospital-acquired infections. And so, from that research, we realized that even though we have about 16.4 million hospital-acquired infections affecting at least 6 emerging economies, which was the scope that we looked at, there are still a lot of opportunity gaps with getting the right data that can be used to make policy changes. And quite frankly, even despite the immense importance and discussions around tackling antimicrobial resistance, without the right data, it's difficult to measure progress. And without measurement, then you really can't do anything about it, right? And so if we really need to move the needle with tackling antimicrobial resistance, which was one of the key conversations we had at this conference, one really needs to start thinking about generating quality data that can be used as a powerful tool in our conversations with policymakers, in our conversations with healthcare providers, with the public, as to what can be done, where the gaps are, what the challenges are. And so that's really the essence of of the discussion.
Thank you for that insight. It's fascinating to hear about these important discussions happening at the Congress. So, you've mentioned some of the reasons why it's important to have this data. What specifically does the vaccine community stand to gain from it?
I think that's an excellent question. So without, like I said, first of all, without data, there can be measurement. Without measurement, there can be action, right? And so as the vaccine community thinks about where there is need, where there are gaps, and when we think about targeting the right population that actually needs the vaccine, we need data. We need to have fit for purpose data. We need to have data that cuts across not just at the global level, but at the subnational level, at the local levels, at the communities. We need to ask the right questions. Who are those, not getting the vaccines, and where the gaps are? And so I think that having the right data will definitely benefit the vaccine economy industry, and beyond just being able to provide targeted vaccines to the people that need it. I think it also has some economic benefits as well. It has benefits in terms of expansion into markets, so market access. And from that standpoint, so those are some of the few benefits that I can mention, but there's a whole lot more. And it will take us like at least 30 minutes to go over those. But I hope that answers your question.
Absolutely. It definitely sounds like there are strong arguments in favor of that case. So, my final question is about your time at the Congress. It's great to have you here. What have you hoped you can achieve by being here, or what were you looking forward to most?
Practical tools. I think that when we think about public health in general, there is a lot of theoretical methods and approaches that people we talk about. We talk about the tools that exist. We talk about what the problem is. But I think for me, it was really important to know, how do we take those tools and take it to those that actually need it. And I think that's one of the benefits that I've gotten from the conversations we've had yesterday. At the keynote panel, we had the CDC director, Mandy Cohen. She gave an excellent presentation about the future of health, and what we should be thinking about when it comes to child immunization, adult immunization, and how these immunization strategies can actually be used in the local settings and how it can be taken to country level. And even when you think about global south and manufacturing of vaccines, how can we empower the global south to start, to have the capacity enough to be able to manufacture their own vaccines? And so for me, this Congress was really, I came here with a lot of, I would say, anticipation, and I was curious to know and learn about what do we need to do, how can we actually take the lessons from everything that we've learned from the pandemic, everything we've learned from science and research, how can we actually then put it to good use? And I think one last thing I wanted to end with is the need at this time to break the silos, right? And foster collaboration. I mean, like public health, prevention strategies, pandemic preparedness, pandemic prevention cannot be done in silos, right? And I see a lot of organizations here trying to foster that collaboration, which I really commend and I encourage. And so it's been a fantastic 3 days, and I'm looking forward to tomorrow as the last one too.
Thank you so much for your time, and I hope the rest of the conference is productive for you.
I'm looking forward to it. Thank you.